All right, gang, we're back talking about the ears, eyes, nose, throat, and now we're going to get into the ears, nose, and throat part of it. And again, as we remember from airway, these are kind of all interconnected, and especially the nose, throat part. But remember that there are canals that lead through to the throat with the ears, can cause us problems. So we need to think about those things as we're starting to treat these ears, nose, throats emergencies that we may actually be responding to. Again, our ear again is the organ of sound. It hears the sound waves, the vibration through the environment, and then that's what processes it. But it also plays a very important role in our equilibrium. And when we see some of the ear structures, and we talk about those ear structures, again, I'm going to go ahead to the ear structure first, and basically say that again, it's these guys back here. This is where our let me swap this around there where we can see it better. And again, this guy right here, these are responsible for maintaining our balance and coordination as well. So when we have inner ear problems, again, we can have some serious issues with that. Now, again, remember that you got the auditory canal, the external canal, you got the tympanic membrane, which is usually your sources of infection. Again, the three bones in the ear, the anvil, the malleus, the staple, again, and it usually has to do with there's the formal ear. Those are known as the middle ear, and then the inside where it actually connects to the auditory nerve. And by the way, these eustachian tubes, these are the guys that and I've actually got a clogged up one of those, especially when my allergies kick up really bad. You feel like you got water in that inner ear, and it's because you do, because it's backing up. So again, so we talked about the external of the ear, known as the pinna. That's what actually collects it. And then by the way, the cerebrum is the cerumen, I should say, is again your earwax. Again, and these can build up within the ear, by the way, and you can cause hearing loss with it. And again, usually that has to be removed they usually use a flushing technique. If you're at a really good doc, he'll suction it out for you. Again, the middle ears is the ossicles, and again, we talked about ossicles back when we talked about A&P. And again, there's three things. If you've got damage to any of those ossicles, by the way, you're not going to get sound waves transmitted through the tympanic membrane, and then it transmitted into sound. Okay, the inner ear, again, it's separated in the middle ear by the oval window, and again, these guys, there's a bony labyrinth in there that protects it, and that's where you're hearing in equilibrium. And people, when they box the ears, that's actually what they're doing. They're not gunning for damage the auditory or the hearing. They're actually trying to damage the inner ear structures to throw them off balance. Now, again, and by the way, those inner ear, the labyrinth, by the way, is filled with fluid known as endomorph. So again, there's going to be fluids all through these, and then it eventually hits the vestibulocochlear nerve. How that for a big one? But again, that's your nerve for hearing. Okay, that's where it actually picks up the things. But the semicircular canals in this, guys, is where again you get the balance. The balance components for that. Again, usually what we get called for is either an infection of the ear, or especially toddlers, they're very common, especially swimmer's ear for sure. Again, bacteria gets in there, they start to grow, and again, it's very painful. You might have a little bit of bleeding from it. If you've got a foreign body in there, kids love to put things in the ear. They love putting things in the ear. Again, usually small forceps or magnets, we can usually irrigate it with warm water. Usually we can get those things out with no real major issue with that. Again, just remember that insects can get in there. I've had calls where the ant crawled in the ear and started stinging the kid. Very painful again, and they're difficult to remove because again, the external auditory canal with mineral oil, that will usually suffocate the insect. Okay, saline will sort of kind of work. But again, mineral oil is kind of like a 100%. It'll do that. If you've got impacted cerebrum, again, lots of earwax. Again, usually they have a muffled sound. Might have some ringing in the ears with that. The best way to get the plug out again is use the dissolving drops. that they sell over the counter. Baby or mineral oil can help loosen it up. Detergents can help. Hydrogen peroxide actually does a pretty decent job of eating it to where you can get that stuff out. Again, the infections, again, these guys are kind of really common, especially the swimmer's ear, the Otitis externa, and again, usually there's pain, drainage, and again, you got some hearing loss from that. And again, usually they'll use an analgesic as topical antibiotic and some sort of anti-inflammatory drugs on them. That you reduce the swelling, they just feel better. And again, but make sure that these parents know, especially in their kids, you got to give that stuff as prescribed every 4 hours. Is usually, you got to wake the kid up. You got to put the drops in their ear, otherwise they're not going to get better. And it's usually caused by difficult to treat bacterial infections. Again, ear drops is kind of the antibiotic therapy is, but if you get really bad ones, yes, they actually do require hospitalizations, and they require some IV antibiotic therapy in order to do that. Otitis media, again, usually happens in the children. You get a block eustachian tube, and the ear kind of fills up with fluid. And what they'll usually do is go in there and pop a little hole in it or put a valve in there, and then that allows it to drain out that way. But if it does get super infected inside the ear like that, it can cause fever. It can actually cause vomiting and diarrhea because it starts messing up the inner ear as well. Again, they'll have a chronic middle ear infection, and again, I can tell you that I've had these where I've had blocked eustachian tubes, and they put 2 valves in each tympanic membrane, and every now and then those valves will get clogged up, and they'd have to go in and break loose the clot and suction them out. And I will tell you again, the initial suctioning out felt horrible, but afterwards it felt great. If you can actually perforate the tympanic membrane, it is a very delicate structure, and it is, again, you can get pus coming from the ear, and the biggest thing with that is most treatments, the perforation will heal on its own. When he pulled the valve out of my one ear, literally within a couple weeks, it was like it had never been there. And again, the treatments for these is analgesia and strategies to prevent the infection. One of the biggest ones for me was to put a fan with a HEPA filter on it in order to reduce my allergies, so therefore the eustachian tube stayed open, and therefore I didn't get, I kept my middle ear draining. So again, this is an example of a perforated tympanic membrane, and again, nothing that we're going to treat, and this is, again, using an otoscope. If you haven't used an otoscope in your ER trips and you get a chance to use an otoscope, the best way to do that, take a look. You can actually see it. By the way, if they're infected, if they've got an infection behind this ear, it can actually put so much pressure that it will perforate the ear. Okay, mastoiditis, again, that's the mastoid bulbs in the skull, and it gets behind it, and again, you get ear pain, drainage. There's a lot of redness over the mastoid bone, and again, usually they have to surgically go in and clean that up. Labyrinthitis, again, these usually are symptomatic. We treat for the vertigo and the dizziness, and again, I've also had this one happen before as well. It's freaky when you first get it. Matter of fact, the first time I got it, I was driving one of the squads, and I turned my head real quick, and it was like, whoa, wait a minute. But again, usually the symptom, usually by simple laying in the right position, making sure you don't turn your head quick. Again, and matter of fact, I'm not going to lie about this one. This is actually a pretty interesting way. If you got somebody that's generally already in a not too good state, if you move their head side to side quick, they'll get dizzy on you. Okay, and you can use that in order to, and you should do that as a test to see if you've got an ear problem that's going on. Again, just simply turn the head to the side and say, okay, snap it real quick to the other side. Oh, I got dizzy. Oh, okay. Not good, right? Well, Menieres disease, this is an inner ear infection which affects the balance and the hearing. And again, you get a brief vertigo, dizziness. And again, that little head trick is the one that is usually a way to tell that. Again, that's the way you can pretty much tell inner ear problem. And there is no cure for that. So that's the problem, is these guys are kind of chronically dizzy or weak. Now our nose, again, remember that's our first cranial nerve there. It's our organ of smell, and again, receptors in the upper part of the nasal cavity. And when our brain processes an incoming signal, we smell. And by the way, it's one of the bigger triggers for a memory reaction, just to kind of keep that in mind. Again, and there's our olfactory nerves that are up here in the very top part. So yeah, shoving stuff up there, yes, you can damage the nerves. Again, this is our turbinates, where we are warming and twisting the air, if you will, to get it down here. It also does filtration as well. Let's see here, next one. So again, the Kieselbracht's plexus, again, that's where most of our 90% of our nosebleeds are. So again, these are usually up in this area right here. The kyphoid plexuses are up here, and again, that's where a majority of your bleeding comes from. And it's usually, and by the way, be suspect if you've got a lot of bleeding going on. Be very suspect that, again, check that blood pressure, because again, people with again, and the epistaxis, again, and usually the anterior bleeds are from that Kieselbracht's plexus. The posterior bleeds, again, usually the blood kind of goes down into the throat, and they say that they can taste it. Okay, and that's what actually we're worried about. The problem is when the blood gets into the stomach. That's where we get some major issues. It's supposed to be epistaxis is a nosebleed, and again, the simple in treating a nosebleed, again, lean them forward, make sure that the airway is good. Pinch the nostrils, okay? You can use a nasal tampon if you guys carry them. You can use catheters to help suction it out. But usually, guys, leaning forward and pinching the nose, holding it for 15 to 20 minutes. Don't let them let it up. Make sure that they can breathe out of their mouth, okay? That's usually what you have to do. But watch out for the nausea, vomiting, again, if they swallowed a lot of blood, okay? If you get foreign bodies up there, again, you remove it. Tweezers work pretty good, but usually by the time they've called us, it's usually because something's so stuck up there that they can't get it out. Okay. Again, rhinitis is an inflammation of the nose. Again, long and short, runny nose. Okay. Again, humidified air, saline drops work good. Suction it out with a bulb syringe with the infants, and then nasal decongestants, antihistamine, Benadryl works wonderful for this. And then nasal corticosteroids, again, reduce the inflammation which is probably end up causing the rhinitis to start with. If you actually get them into these sinuses, and backing up to this picture here, again, your sinuses are up in these areas and off to the side, but they get infected. And if they do get infected, again, usually bad breath, loss of smell, again, they decongestants, antihistamines, corticosteroids, and then they may actually have to use an antibiotic in order to help treat them. So again, if we're looking at sinusitis, that's usually when we lift our nose up and do it like so. And again, if you got an ears, nose, and throat doctor, he carries that little tool around with him everywhere. Everything's in the sinuses, by the way, I will tell you. He's like, yep, here's your problem is, this guy was draining into the back of your throat, which caused an infection. Yeah, thanks, doc. I appreciate it. All right. So again, the oral cavity goes there. I think we're all good with the throat and all the different parts of that. And I think we've seen this picture enough. But again, because when we're going to intubate, we're going bassus. Just remember that the tongue is a sensation organ as well. We're pretty careful with that. So again, the back of the throat is the 9th cranial nerve. The more to the forward is the 7th cranial. Okay. And by the way, we get different flavors from the different areas. Okay. So again, your bitters are in the back, and then that was a reaction to, again, usually poisonous material. Things that we don't like are usually the bitters. Again, sour, salty, sweet. Again, we like sweets. That's kind of why we detect it first. And again, you got your tonsils and your adenoids towards the back. They are a constant source of infection, and they usually in the olden days, they would actually, if you continue to have tonsil infections, they would actually go in and go ahead and remove the tonsils. Again, we talked about all those lovely structures there. So again, the biggest thing is if you got pharyngitis or tonsillitis, there's swelling in there. And then the bacterial cause or viral cause, either one of them can cause it. Usually get a red swollen, and then they can actually form a pus pocket in the back, which can turn into an airway nightmare. Especially if that pus pocket breaks, you better have some suction ready to get and start cleaning up all that stuff. Think of it as a huge, gigantic zit inside their throat. Yuck. Okay. Again, usually bacterial infections is probably a strep throat. When they do a culture, they'll reach back there and touch that area. If they see white back there, it's more than likely it's going to be a bacterial infection. Again, usually the fungals, this is known as oral candidiasis, or the more common name thrush. Okay, and it's again, usually they use an antifungal on them, but you see this a lot with their infants, diabetics that have a really nasty, not good control, your AIDS patients. Again, the AIDS patient very susceptible to this one. It looks like a cream-colored deposit on there, and again, usually you remove the offending agent. Usually they'll brush it off, toothbrush it out with a clean toothbrush a couple times, and then they'll use an antifungal agent on it in order to correct the thrushy problem. The Peritonsillar Abscess, we talked about that. Again, just remember, make sure that you got plenty of airway with that, guys, especially if you're doing a transfer, because they like to send these up to Shands a lot, or they like to send them to a tertiary facility. Guys, just make sure you got plenty of airway. And what I mean that is like assure that they've got plenty of airway. Okay? So, again, and if you do have the peritonsillar abscess like that, it's very difficult to get them intubated when the swelling gets so bad on that, okay? But you're going to get a muffled sound, a sore throat, tender glands in the jaw and the throat is the other big sign of it. Usually when you look back there, you can see it, okay? A big, gigantic, looks like a zit in the back of the throat. Again, self-suction with the Yankard, hand them the Yankard, show them how to use the thumb hole, say, hey, when you start feeling this stuff building up, start sucking it out, okay? And so, again, antiemetics and analgesias are not necessarily a bad thing, especially if it ruptures, okay? Ludwigs angina. Let's talk about that. It's a cellulitis at the floor of the mouth, okay? It occurs after infection of the teeth. And the problem is guys, this actually goes into the heart and can go into the heart valves. And again, it can cause mental status changes. It sounds like that they got the person sounds like they got a hot potato in their mouth. And again, and you might actually have to do a surgical airway on these people, and it's cured with a proper protection of the airway. So you got to really be careful with that. The biggest thing is, remember, intubating that person is probably not going to be a good idea, okay? So it's cellulitis of the mouth, essentially, is what it is. One other thing about the dental things, if the person has a heart valve, please beware if they've had dental procedures. Even if they haven't had, you can actually get a cardiac infection by going through the oral route. If they have dental work and they've recently had heart surgery or heart valve replacement, be very aware of that, because I'm going to tell you right now, they start growing vegetation on those artificial valves, okay? Your patient will die once the emboli start breaking off, okay? So be aware of that, all right? And ask that question. Especially if you've got somebody with dental work, they just had some dental work, and they're having chest pain, or they may be having respiratory-related symptoms. It's one of those dumb questions that you ask to kind of say, hey, just to make sure, okay? Dental algae or dental abscesses, we get called to these, and my favorite statement that I hear for this one is there's nothing we can do. You are right, but again, it's usually not a life-threatening emergency, but it hurts like crazy, okay? So, again, usually because the tooth is broken down, or they exposed one of the nerves in there, and it'll develop an infection spot which swells even more, which causes a lot of pain. And usually the way that they treat that is the dental care. They usually either pull the tooth or drain the abscess, okay? And again, not too much you can do other than when we get them to the hospital, if they get a dental surgeon in there to drain off the abscess, okay? There are some home remedies that, saltwater rinses that might help relieve some of it. Usually it draws out some of the fluid, which relieves some of the pain and pressure. If you got a foreign body in the throat, again, people do weird things, all right? So make sure that the airway is open. If you can't open it, remove the foreign body, okay? And again, remember, Epiglottitis, this guy, super duper dangerous. We're going to talk a lot more about that. We talked about it when we were in pediatrics, Problem is the adults are getting it, and it can be from either a viral or a bacterial form. Again, you get fever. Usually, a high fever came on quickly. Sore throat. They're going to be drooling. They're going to be sitting forward. Lots of stridor in the upper airways. Okay, and again, antibiotic therapy. But remember, going in and touching their epiglottis is a absolute really bad thing to do. Think surgical crike at that point, okay, when you got epiglottitis. Laryngitis, again, as they swell it up, again, these usually, it can be a viral infection or it can be a bacterial infection that causes it. Again, usually if they got foreign bodies in there from GERD, again, pneumonias, again, usually they lose their voice with the laryngitis, but as far as an emergency, very rarely, if ever, is it going to be that. Now, tracheitis is another little, again, it swells the trachea. So if you got a patient that you know has tracheitis, you might want to, if you have to actually intubate this patient, you really want to make sure you go at least a tube size lower, probably even more. You may have some difficulty. You might be able to get it past the vocal cords, but you may have difficulty getting it any farther. You may, again, it's, again, an airway nightmare. And if you're going to transport somewhere, make sure that they know that you can take them somewhere where they can actually get ventilated, okay? Temporomandibular joints, again, this is the temporal bone in the mandible. It locks the teeth, if you will. It kind of sets it in the wrong position. It kind of clicks or pops. Dull facial pain, and when it does kick on, it really hurts, really painful. So that's the explanation of TMJ. Guys, again, there's a lot of things in the ears, eyes, nose, throat, okay? And some of them can be life-threatening, if not life-threatening, life-changing, or visualization. So, again, don't take them lightly. That's the key thing I want to stress to you. There's some times that this is actually true emergency, and we need to deal with it. All right, sorry, that's it for today, and I will see you guys on the next video.